Stop before you watch this. Answer one question. Have you ever rinsed your nose with tap water, a neti pot, a sinus rinse, a nasal spray? If yes, this video is about you. A previously healthy 71-year-old woman in Texas did exactly that. She rinsed her nose with tap water at a campground. 4 days later, her brain began shutting down. 8 days after that, she was gone. I'm Dr. Rachel Rayan, and this is Medical Detective. Our patient, we'll call her MW, was 71 years old, healthy, active. She was the kind of woman who took care of herself. Regular doctor visits, no major medical history, a woman who did everything right. In late spring 2025, MW and her family went on a road trip. They stayed at a campground in Texas. She used the campground's RV water faucet to fill her nasal irrigation device. Something she had done hundreds of times before, a completely normal, doctor-recommended health habit. That night, she tilted her head back. She squeezed the rinse bottle. Water entered her nose. She had no idea that somewhere inside that water, invisible to any human eye, something was alive. Something that had been waiting for exactly this moment. For 3 days, nothing. She felt completely fine. She packed up the campsite. She drove home to Texas. She had dinner with her family, completely normal. Then, 4 days after the rinse, she woke up with a headache, fever. She felt confused. Her family thought it was just a bad cold. Here's what was actually happening inside her skull at that exact moment. And I need you to understand this because this is why she had no chance once it began. Naegleria fowleri, the brain-eating amoeba, had entered through her nose and was now traveling along her olfactory nerve, the nerve responsible for smell, directly into her brain. And once it enters the brain, it does not stop. It consumes neurons, it destroys tissue, it causes the brain to swell until there is nothing left to save. By day 5, MW was rushed to the hospital. She now had severe neck stiffness, a sign of brain inflammation. She was having visual disturbances. She couldn't keep her balance. Doctors suspected bacterial meningitis initially. The symptoms looked almost identical. The doctors treated her aggressively. Antibiotics, antivirals, every weapon they had. But here is the brutal truth about Naegleria fowleri. By the time symptoms appear, the amoeba has already been in the brain for days. The damage is already catastrophic. The window to save a patient is almost always already closed. On day 7, Monsieur W developed seizures. Her brain was swelling beyond what any intervention could control. On day 8, she died. 8 days from a nose rinse to death. Now I need to explain something that the CDC itself calls terrifying, and I want every single person watching to understand this completely. Naegleria fowleri does not infect you if you drink contaminated water. You can swallow it and your stomach acid destroys it, and it only becomes deadly through one specific route, up the nose. And here is what makes MW's case particularly alarming. She was not swimming in a lake. She was not diving in a river. She was standing in a campground bathroom using a nasal rinse with tap water, and something millions of Americans, and perhaps you do, every single night. The CDC tested the campground's RV water supply 23 days after MW had used it. They could not detect the amoeba by then, but they found something equally damning. The water had inadequate levels of disinfectant. It was cloudier than safe drinking water standards allow. The water looked clean. It was not. Here are the numbers that should make every American stop and listen. Since 1962, there have been 164 confirmed cases of brain-eating amoeba infection in the United States. Of those 164 people, only 4 survived. That is a fatality rate of 97.6%. This is one of the deadliest infections known to modern medicine. And here is the warning that the CDC put in their official report, word for word, quote, "This case reinforces the potential for serious health risks associated with improper use of nasal irrigation devices." And the CDC is telling you directly that your nose rinse could kill you. Here's what you need to do right now. And please share this with everyone you know. Number 1, never use unsterilized tap water in a nasal rinse, neti pot, or any nasal irrigation device. Use only distilled water, sterile water, or water you have boiled yourself and allowed to cool. Number 2, if you swim in freshwater lakes or rivers this summer, keep your head above water and do not let water go up your nose. Number 3, if anyone you know develops sudden severe headache, fever, confusion, or neck stiffness within 2 weeks of water exposure to the nose, go to the ER immediately and specifically mention Naegleria fowleri. That one phrase could save their life. Now tell me something. Did you know any of this before watching this video? Drop a comment right now, yes or no, because I genuinely want to know how many people have never heard of this.